Dizziness is a common sensation that can make you feel unsteady, lightheaded, or as if the world is spinning. It is often a symptom of an underlying condition rather than the disease itself. Causes can range from inner ear problems and motion sickness to more serious conditions like heart issues or neurological disorders. The symptoms of dizziness include lightheadedness, feeling faint, unsteadiness or loss of balance, a spinning sensation known as vertigo, and sometimes nausea or vomiting. These symptoms can vary in intensity and duration depending on the underlying cause. Most cases of dizziness can be managed at home with simple self-care measures. If you feel dizzy, it's advisable to sit or lie down until the sensation passes. Moving slowly and carefully can help prevent falls. Staying hydrated by drinking plenty of water is crucial, as dehydration can worsen dizziness. Eating regular meals helps maintain blood sugar levels, which can also impact how dizzy you feel. In cases of severe dizziness, resting in a quiet, dark place can provide relief. There are certain actions to avoid when experiencing dizziness. Sudden changes in position or rapid head movements can intensify the feeling of dizziness, so these should be avoided. It is also important to refrain from driving or operating heavy machinery until the dizziness has completely subsided to prevent accidents. Limiting the intake of alcohol, caffeine and tobacco is also advised, as these substances can aggravate dizziness. While occasional dizziness is not usually a cause for concern, persistent or recurrent dizziness warrants medical attention. If you experience severe dizziness, along with other symptoms such as a headache, chest pain, shortness of breath, or vision changes, you should contact a healthcare provider. Additionally, if dizziness leads to difficulty in walking, weakness, numbness, or follows a head injury, seeking immediate medical advice is crucial. To reduce the likelihood of experiencing dizziness, it's also helpful to stand up slowly from sitting or lying positions. Ensuring you get enough rest and managing stress effectively can also play a role in prevention. Maintaining a healthy diet and staying well hydrated are fundamental in preventing dizziness. If you have underlying health conditions, managing them with your doctor's guidance is essential to prevent dizziness as a symptom. By understanding the causes and symptoms of dizziness and following these management and prevention tips, you can minimize its impact on your daily life. If dizziness persists or worsens, seeking professional medical advice is essential.